Good evening, I'm Eugene Chan and welcome to Straight Talk. Our guest is Dr. Libby Lee, the new Chief Executive of the Hospital Authority. Dr. Lee previously served as the Undersecretary for Health and before that spent over a decade in senior roles at the Hospital Authority, including the Director of Strategy and Planning. She is a trained anesthesiologist with a Master's in Public Health, and with this combination of frontline medical training and public health administrative experience, she now takes on the task of steering the Hospital Authority into its next chapter. And congratulations, Libby, and welcome to the show again.
Hi, Eugene.
Libby, you have just stepped into one of the most important leadership of the Hong Kong's healthcare system. And you know, Hong Kong Public Hospital has been described as one of the very best in the world at delivering high quality care at actually very low cost to the patients. And I would say the pressures are mounting due to the aging population, as well as, of course, the always limited resources. Maybe we can start to tell the viewers where we are at the moment. Maybe you can walk us through with the latest figures, say how many patients are we looking after and what is your manpower size and such figures.
Okay. So the Hospital Authority is established under the ordinance, the Hospital Authority Ordinance. This is a statutory body. We are charged to take care of the patients with the public hospital system, including the clinics, the outpatient clinics and also inpatients. At the current moment, we actually are serving the population and giving around 8.8 bed days per year. And then we also given like 8.7 million specialty outpatient clinics attendance per year. And in our primary health care, we are providing around 6.3 million attendances in the general outpatient clinic. So I would say that in the whole Hong Kong medical healthcare system, the public system actually is contributing is around 80% inpatient services and around 30% of the outpatient services. So we are actually a key stakeholders in the whole healthcare system. And I must say that in terms of health, Hong Kong is actually doing very, very well. For example, we have the lowest, we have the highest life expectancy rate among the whole world. And then we have the lowest maternity mortality rate, lowest infant mortality rate, but only spending 9.1% of GDP. So we are a very efficient system with good health outcome.
Right, Libby, I know that apart from the obvious hospital services the community enjoyed, you also have a very important accident and A&E, accident and emergency, special clinics, and also community outreach. Just now when you said efficient, one must say that you just mentioned the average length of stay for patients. So how does the latest statistics that you just mentioned will tell us how quickly are the patients going through our system? Because there are some acute cases and also the convalescent care.
All right. So I'll just maybe I describe a bit of our services, including inpatient service. We have acute inpatient services and convalescent and rehabilitation inpatient services. So the average length of stay, if a patient comes through our system, they probably will stay in our hospital system like 6 days, and then they will be discharged home, supported by outpatient clinics as well as some community services. For example, community nurse services if they have wound dressing, that kind of needs. And then, yes, our attendance of A&E is around 2 million per year. That means 2 million people attend the A&E within a year. And some of them will get admitted into the hospital system, some will be followed up in an outpatient, some may be fit enough to discharge from the A&E. So this is the way that how we actually provide our services in the healthcare system. The entry point will be the A&E, outpatient clinic, stay in the hospital, discharged back to the community and supported by our community care. And also we collaborate very well with the Primary Healthcare Commission so that we are actually in the development and the further development of our primary health care in the community. Just
now you mentioned that you stated that actually now is a very efficient medical system compared to, I'm sure, other parts of the world. So what are the areas that you think we are sort of excel compared to other countries?
I guess the strongest point of our system is actually for the public health services system, we are united under one roof. That means, in terms of buying drugs, equipment, we have the advantage of doing the central procurement so that we are more competitive in the market to bring down the cost. So that's why it's one of the key factors make us more efficient. Another thing is actually we are the main background or the soil ground to train our professionals. So when the doctors graduated, when the nurse graduated, they would get into the training post in our system, in the public hospital system, and get trained and specialize. This is very efficient because they can rotate to different streams, they can broaden their horizon, and then they are very effective because it's standardized our training program so that they can get the fellowship, in the shortest period of time. I guess this is the way that while we have advantages against other countries because our systems are over there in place and we provide opportunities for our manpower to be trained up as a really professional and specialist.
Right. I think so far we've been saying some very good points of the system. But how about if you look at the sheer volume of people in Hong Kong, is the manpower under your team, is it adequate or are we still understaffed?
I must say that we are running a very efficient system. That means to a certain extent, we will get better even better if we have more manpower.
Right.
When you look at for example, just use doctor as an example, when we look at the doctor per population, we are almost the lowest among the Asian countries, running 2.3% per thousand population, 2.3 per thousand population. So there are room for improvement. So that's why there's lots of policy in recruiting more students, local, overseas, as well as we are talking about, the government is thinking about opening a third medical school in order to beef up the manpower. So this is one of the issues, the manpower. More particularly for the nurses. Nurses are more difficult because they're really, we around now got 30,000 nurses in the system, but we have quite a number of shortfall. And a lot of nurses being trained as nurses may not end up being a nurse in the system. So that's why we also follow the policy, recruiting more non-locally nurses come here, as well as increases the number of training posts.
Right, I'm going to ask you later on about the actual attrition rate of our team.
Good.
One area that I'm sure the viewers will, when they think of hospital authority, when XJ is on the news, unfortunately, sometimes is when some of these serious events happen in Hong Kong, some of the medical unfortunate incidents. But I've just done some homework because compared to international standards, Hong Kong is only 0.32 out of 100,000 people compared to 0.43 in the US and even 0.57 in the UK. Does it mean that people in Hong Kong are getting, or the public is more expecting more from XJ compared to the rest of the world? Or do you think it's a fair comment by the public sometimes say that hospital authority do have this serious event that I'm sure none of us wanted, but how do you respond to my statement?
I guess in any healthcare system, it is impossible to say that there won't be any medical incidents, or we call it about sentinel events, or medical incidents, because in our industry, basically, it's human to human. The human touch is actually a major component, and by being human, we cannot be assured that we are 100% safe-proof. So I guess it is impossible to say a medical system without medical incidents. But the point is how to reduce it and how do we learn from these medical incidents. So, well, when we compare with overseas countries, we're well aware that there are differences between systems to systems. For example, the speak-up culture, the trend of bringing up incidents may not be the same among different systems. So even we look at the number, I would prefer comparing the number with our past trend.
Right.
But be honest, our numbers are not huge in that sense, but every medical incidents are not desirable. So we can understand that public have expectation on us, and also patients suffer in terms of medical incidents. So our key is actually not focusing on a number, but how to improve from that medical incidents.
Right, Libby, let me come back to the point I just raised up earlier about staffing, which is always a hot topic. The attrition numbers, I've looked it up, is about 5% annual attrition rate for doctors and a bit higher, like 7% for the nurses. That means over 340 doctors or 1,800 nurses have left the service last year. Why are we losing so many dedicated professionals?
Oh, there are two components for that. The first one is normal retirement. Of course, we have baby boomers, and this certain years, they probably will retire from the systems. And you think about it, we got 7,700 doctors. So 5% attrition rate probably is quite a normal turnover rate for the professionals. And some will leave the public system to private, some may migrate to other countries, and some are retirement. So I guess 5% is almost we're looking at. But by previous years, we can go up to 8% or 9%. So I guess what we should prepare is a healthy turnover about each professionals. Look at nurses. We have 30,000 nurses in the system. So you're talking about 6.7%, 1,800. It's not that a lot, but it's a normal turnover. But what we want to keep in our system is actually the experience that they have. When the experienced staff leave the system, some newcomers replace the post. The newcomers may be less experienced. So what we're looking at is how to retain this experience in the system for better patient care.
Right. Maybe one more area I'd like to explore before the break is burnout. I'm sure a lot of people will say that, even you have the numbers, they must be motivated. I'm sure you went through the system over the last few decades. You know what the frustrations are. How do you minimize this burnout and making sure they are feeling very welcome or feeling fulfilled at their job? What will you do about that?
It's a very good question, Eugene. Burnout. Burnout is actually in healthcare profession is quite a severe problem, not only in Hong Kong, it's internationally. Because for self-expectation as well as the public expectation, staff usually get overwhelmed because of the expectation and also the workload. I guess we need to use some smart method to reduce the workload, and also we need some refresher, energizer, to make staff more eager to stay in the system. So I would say the way that we engage our staff in the system on providing service to patient can change a bit so that they feel more energy when they provide a service to the patient. We can talk about it later on how we actually energize them.
Right, Libby, time for a quick break now, but viewers, do come back with more Straight Talk. Thank you for staying with us. Dr. Libby Lee, the newly appointed Chief Executive of the Hospital Authority, is with us, and she is sharing with us her vision and strategies for sustaining our public hospitals for the next generation. Libby, as the title suggests, next generation, meaning that I think as a public person, I think that HA is doing a great job, but how do we sustain it for the next generation? And maybe we can just go on a bit more on the staff burnout rate we just touched on the first half. I've read your interviews recently, and you have spoken passionately about bringing warmth and speak-up culture to the hospital authority. You have said if you're good to staff, they will be good to the patients. Can you sort of elaborate a bit more on that? And what I mean is, what tangible changes are you making to improve the working culture so that the staff will actually feel valued and stay on?
Okay, so staff is not only doing the routine daily work operations. I think staff has a lot to can offer, and they would like to give out more apart from the normal daily operations. For example, what they are aspired to during the daily work, the staff stay in the public hospital system really have a passion and also vision they want to achieve, because there are so many ways to have a more comfortable life, and they choose to stay in the hospital authority, which provides so many, day in, day out services. They really want to achieve something like service model change, or for example, using new adopted technology in the system so that make the whole system a better system for the patients and also for the staff. So in the coming years, I would like to engage them a bit more. I think this is engagement. Staff engagement is the key medicine to take away the burnout. Apart from reducing the workload, how to engage them to have a bigger contribution, a higher level of involvement in the whole system. I think that will be actually improving the staff morale and make them passion becomes an action, really help them to stay and to keep their energy in doing their work. So warmth is actually something like improving staff communications, more staff engagement during the policy making and service model changes, and then let them lead the way. I think they could offer a lot more that they want to offer So this is the way that I think that is the future. Because I has been a frontline, many years ago. I do think that we have good ideas. I have good ideas. If there's a way that I can turn these good ideas into action, I will be very happy to stay in the system and serve.
Well, I want to ask you about speak-up culture. What do you mean? You mean the nurses or the junior doctors will be going directly to you, or they go through the system through the seniors?
I think the speak-up culture is a culture that you are not afraid to speak out your mind. And if you see something wrong, or if you see someone's behavior is not that right, you are not afraid to tell him or tell the senior or tell the colleagues that we actually can have a way to improve that. I think this, you need to feel safe before you can do this. Even in a meeting, people dare not to express their opinion because they think that is not safe. If I say something stupid and someone will laugh at me, I guess speak-up culture is a morale, or is a culture that staff will feel safe to express their opinion without any consequences. And this is something that I want we have, because brilliant ideas are come out like this.
I like what you said, without any consequences, because a lot of professionals, even myself, you have to be pretty confident to make a comment. Sometimes you may think, oh, it may show your actual inadequacies, but hopefully things will improve under your leadership. Another area that we want to talk about is recruiting non-locally trained doctors and nurses. How is it impacting the front line? I mean, has it been improvement, or is still a sort of a grinding in period?
I would tend to think that currently we have like 300 something doctors in our system already. We are now actually recruiting more non-locally nurses, but the competition is really keen. I tend to think that non-locally doctors are a source of manpower actually can serve in our system. And when they join HA, they will be part of our staff. I would not like to distinguish them from non-local and local. They are our staff. But in fact, the way that they're trained, like overseas, really have some difference from our locally trained people. And there will be some, reaction, chemical reaction between these two culture of being brought up. So this is a very good thing, because in my old days, I do anesthesia. Half of my department are actually foreigners, are not local people. And then they bring good ideas actually when these two culture, I won't say clash, react together, and they can really give a positive outcome. So even with the manpower issue has solved, I think I still see the merit to bring non-local people coming back to the system.
Maybe another area, I mean, there are a lot of things I want to ask you today.
Right.
Another area you have talked about is actually the possibility of extending operating hours at the general outpatient clinic, something very new to the Hong Kong public. I think you want to work until like 10 o'clock in the evening. So when is this going to happen, and do we have enough resources for it?
Okay, so we are exploring it. We hope that after all exploration, we can bring it into real action sooner the better. The idea is actually we want to run a very smart system. So, for the whole day long, basically we can analyze which part of time people will come to use your general outpatient clinic. Maybe, some hours are more patient, some hours are less patient. So if we extend the operating hours, likely the people just finish work, they would like to see a doctor, they have chance to see it, and then we can actually tailor-make the quota according to the needs, the service needs. So I would think that is a smarter way or operation for the general outpatient. So will that we have enough resources to do this? Resources in terms of money, people, and the facilities. Currently, the facilities are adequate because we just opening longer. But in the near future, we will need more clinics. Currently, we actually are not able to fulfill all the need for the Hong Kong people for the public general outpatient. So facilities is one issue. For manpower, we also have the need to train up more family doctors because Hong Kong's really need a robust primary healthcare system.
Right. Just now, you just mentioned about smart technology as well, and I know that in Zhong Guan Hospital, you are piloting one-stop digital kiosk that patients don't have to queue up for everything. They just go there to arrange seeing the doctor, collecting the medicine, or even booking the follow-up, etc. So how quickly can you roll out such initiatives, and whether to other clusters, so that it genuinely reduce waiting time?
Okay. So basically, we have two pilots at the current moment. The one pilot is the Zhong Guan O. The other pilot is the Hong Kong Eye Hospital. Hong Kong Eye Hospital is not only using a kiosk to do that, they try to do it in HA Go. So in your iPhone or in your cell phone, smartphone, basically you can use our HAGO apps. You can actually, when you come to our clinic and see the doctor, they will show you the roadmap, where to see, where to go. And then we hopefully can enhance these apps so that later on you can book your, after consultation, next follow-up appointment, the next blood taking appointment. We are working on that. I hope that we can do it in a year of time. For this system, currently not perfect, but we also want to try it out in all eye departments of our system. So hopefully within this year, we can actually have the system implemented in all eye departments. For the Zheng Guan 01, it's basically for special outpatient. We are actually streamlining, improving the system, and we are testing it out within this year, and different clinics trying it out, see whether we can further improve it and make it more tailor-made for each clinic. So there's a roadmap for all this.
Right, as you're telling us about the good things actuaries are doing, quickly something came to my mind. Will you be your own victim of your own successes? Because there'll be more people coming, and then, it's like snowball. It's going to be more and more, as you know, we have an aging population. Costs are rising, and I've checked that the actually budget has grown significantly from $90 billion in 2022 to 23 to the proposed $107 billion in 25 to 26. Do you think the current funding model is sustainable, or will we need to rethink how the whole healthcare is financed? That's the title of the show today.
I guess what I hope is actually sustainability is not a question to ask. We have to work towards the sustainability. So when I go back to HA, I look in the resources, the expenditure, that kind of stuff. Strictly speaking, we break it down to two components. The one component is actually for the population aging, demographic changes, chronic disease incidents. The growth is steadily around 3% every year. So this part actually can be handled by primary healthcare, shifting service model. But what could not be really handled is about the increase in service cost. That is the technology adoption. We see the rate is actually exponentially increasing. So I guess smart adoption of technology is an essential rate of a way to actually control the budget and also improve cost effectiveness and then improve and make it more sustainable. What to adopt and what not to adopt is a key.
Right. Maybe there's also the upcoming fees reform will be another hot topic that the public will be engaging. You have stated that it's based on co-payment by those who can afford and co-payment by those who may not be able to afford it at all. So how are you going to do that? Because payment is a very sensitive issue, especially the current economy, and the government is trying to cut down expenditure. Well, how will you answer that question?
Okay, fees and charges changes reform is a reform to shift the resources from the less needy to the most needed patient. So we actually have waiver system to make people cannot afford the system. They have ways to help them, and when we get back the resources from a bit more co-pay from those who could afford, or for those who have a lighter disease or less serious disease, we can basically have these resources redistributed to cover those who are really needy. Right. So it's a redistribution of resources, in fact.
Right. So you're confident that we can afford this healthcare system in the future, despite it's sort of 9% of the GDP?
It's not a confidence level, it's a must-do thing. Right. So we must make it a sustainable system for the Hong Kong people.
Right. Thank you, Libby, for sharing your strategies and your insights. And Hong Kong's public hospitals serve millions every year and remain the backbone of our healthcare. Sustaining them for the next generation is crucial and will hinge on recruiting talent, implementing smart financial reforms, and embracing a new model of care. Thank you for joining us on Straight Talk, and have a good evening.